I am Dr. Rupam Das, and on the behalf of World Heart Day on 20th September, I have got the opportunity to discuss something about hypertension. Now, hypertension is a deadly disease, a silent killer, and unless we know the disease and we increase our knowledge about hypertension, it is very difficult to detect on our part. So I will shortly tell you about something about hypertension on this World Heart Day. Usually everyone would like to have healthy or normal blood pressure, but what actually does it mean? Basically, each time when the heart beats, it pumps blood into blood vessel. This creates a pressure against the wall of the blood vessel. This is actually called blood pressure or high blood pressure or hypertension. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices like not enough regular physical exercise, obesity, smoking, high alcohol consumption, getting into high stress. Other risk factors include age, family history of hypertension, excess salt intake, and eating of processed and junk food. Now, moving on, hypertension does not have any obvious signs and symptoms. It's a silent killer. That's why it is often gets undetected. So measuring blood pressure is the only way to know whether the person have a high blood pressure or not. If a person is experiencing some of the symptoms, then one should get their blood pressure checked. Now, healthy or normal blood pressure should be lower than 120 by 80 mmHg, or it can also read as 120 over 80 mmHg. If the blood pressure level is more than 140 by 90 mmHg, then we call this as hypertension. If the blood pressure is higher than this level, then he or she might be at risk of developing serious heart disease. The risks can be prevented and reduced by taking steps towards a healthier lifestyle. So let's talk out at these regular strategies one by one. Regular exercise. Exercise can be a huge drug-free approach to lowering blood pressure. Regular physical activity makes a person's heart stronger. Consistent exercise also keeps you a healthy weight, which in my opinion is an important way to control blood pressure. One should aim for at least 30 minutes of aerobic exercise most days of the week. High blood pressure can be reduced by doing regular exercise, structured exercises such as brisk walking, jogging, swimming, etc. Now, second is we should have a healthy diet. A diet with high intake of vegetable, fruits, whole grains is recommended for hypertensive patients. For lowering blood pressure or preventing hypertension, thorough dietary intervention, one such diet is known as DASH diet. DASH means dietary approach to stop hypertension diet. DASH diet is nothing but whole grain, fruits, vegetables, and low-fat dairy products, and skims on saturated fats and cholesterol, which can lower blood pressure up to 11 mmHg if the pressure is high. In diet, we should reduce our sodium intake. A small reduction is in sodium reduces pressure by about 5 to 6 mmHg. If you have high blood pressure, you should reduce sodium. And how to know about reduced sodium? You should have to look about the food levels, the product levels in the bottles. If possible, consume low sodium alternative salts are there in the market. You have to choose fewer processed food. So because most of the sodium is added during preservation and processing of the fruits. Now we have to change our addiction and to stop smoking. And quitting smoking can effectively reduce the risk of heart disease and improve overall health, which also causes low and reduce our blood pressure. Now, regular pressure monitoring. Some of the hypertensive patients check their blood pressure by visiting doctors, but it is not always possible for the patient to visit doctor. And in our country, most of the patients remain in very remote areas, and it is advised to check up their blood pressure by self. Hence, most often I advise patients self monitoring of their blood pressure at home. Self monitoring helps a patient to measure BP at defined times of the day throughout the day over a longer period of time. It also assists a doctor to get a more complete picture of person's blood pressure reading at different time levels. Now, stress management. By learning how to relax, manage stress can improve emotion and physical health and lowers high blood pressure. Stress management technique include exercise, listening to music, focusing on some calm and peaceful yoga, meditation, etc. Adherence to medication. Now, the habits which lower blood pressure, but the blood pressure is not under control, some medicines have to be prescribed. So medicine to lower blood pressure by recommended doctor if the pressure is consistently high by the above behaviors, usually above 140/90. Adherence to medicine is very important as it controls your blood pressure regularly. At last, I would suggest that there is nothing more precious than a fit and healthy life. Adopting a healthy lifestyle can help us enjoy a long and healthy life. High blood pressure can be prevented as well as controlled in many ways. It is very much possible to maintain a normal blood pressure level with regular monitoring and preventive care. So, so I take this opportunity in this World Heart Day on 29 September that to maintain a healthy life, and we should take pledge in this occasion that we should take healthy diet and do regular exercise, because before medication, the number one medication to reduce hypertension and to keep remain healthy is diet and exercise, which is recommended worldwide. Now, thank you.